Hey, everybody. Today I'm delighted to be discussing ethical AI and healthcare with Dr. Heather Mattie. Dr. Heather Mattie is the co-director at the Harvard T.H. Chan School of Public Health of their Health Data Science programs, lecturer in biostatistics, and director of their Equity, Diversity, Inclusion, and Belonging programs. Did I get all that right, Dr. Mattie?
Yeah, that's
It's a bit
right.
of a mouthful. I feel like I'm reading off three different full-time jobs.
It feels like that.
Yeah, I bet. And I didn't I have a little paragraph here written about your research as well, which is a whole other job, but maybe I'll just ask you if you could summarize that a little bit for me and for us.
Yeah. And thanks again for having me. So excited to be here. Um, I'm a trained biostatistician and I did a lot of sort of machine learning in my dissertation, and learned how to sort of model how our social connections with each other, both in person and online, affect our health and kind of affect the spread of a disease or some sort of symptom or information. So that was called network science. But through the machine learning world, I learned about algorithmic bias, which is if we use these machine learning models to make predictions, for people in a healthcare or clinical setting, what happens when it makes the wrong predictions or some sort of harmful prediction for different groups of people.
Hmm.
And if you're doing it in healthcare, that can be a lot of people and it can be used at scale. So it can be pretty dangerous. And so that got me sort of into this whole clinical AI realm and health equity, really trying to just make sure that the machine learning and deep learning and models and then the AI tools that we use and we want to possibly implement in healthcare and medicine are fair, trustworthy, ethical, all of those things. So it's been a non-straightforward path, but that's kind of how I ended up in this area.
Well, it strikes me that this overlap is something that anyone who's involved in this overlap is going to be having a a curvy path because it's so new. This is not something we had 50 years ago for sure. Um, except for maybe the bias part. I imagine we got started on that fairly early when we talk about statistics and machine learning. So you mentioned AI and algorithms, and so I guess the first thing I'm curious about is what what we mean when we say AI in this context, when we're talking about healthcare, what kind of algorithms are in use? Yeah, if I could just let you talk about that for a sec.
Yeah. And so AI, I mean, it really is just anything that we can kind of automate and help make predictions or any kind of model that helps us make predictions or helps us locate, for example, an area on an X-ray that maybe is an indicator of some sort of illness or disease. So it's kind of any model in the healthcare context that we can use to aid or augment clinical decision making.
Okay.
Um, at the very base level, I mean, AI could be considered your calculator. So
Sure.
it could be very, very basic. It doesn't have to be machine learning and deep learning and these
Yeah.
like large language models and things that have come out. But those models are definitely kind of what people know and kind of recognize.
I,
Yeah.
I definitely think that there's an assumption coming in when I say, or when we say AI in healthcare, that there's a doctor waiting before they come in to see the patient that's immediately asking GPT or something, treatments for strep throat or whatever it might be. But that is not just what we're talking about here. Excellent.
No,
Why is
definitely.
um why is equity really part of this equation? I think there's this assumption that when we're talking about algorithms, we're talking about math and code, that 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 things like racism and sexism would not be part of it because those are not in the numbers and not in the machine.
Right. Yeah, so it really comes from the data that we feed these models. And
Hmm.
these models are trained on typically massive data sets or fairly large data sets. Um, that is where those types of bias or sexism and racism can kind of creep in because especially in the United States, we have a history of racism in all aspects of society, but in healthcare as well, where a lot of minoritized groups don't have the same access as other groups do. So typically people of color have less access to healthcare than um, white or Caucasian individuals. That limited access to healthcare means that we don't have as much data on those people. And if we don't have as much data, we don't have as much information about those people. And so the less information we have about you, the worse in theory our predictions are going to be for our model because we need more information. These
Yeah.
models are so data intensive and data hungry, I call them, that the more information we have about you or people who are like you, the better predictions we can make for you. So access, because of race or ethnicity or even rurality, like if you live in a very
Hmm.
rural part of the
Yep.
US,
Very true.
if you're homeless, um, that not having that data means you're not
Yeah.
represented. And that's where these kind of biases can creep in, where
Yeah.
the model is just not going to perform as accurately for these populations.
I really love that. One of my personal soapboxes about data is that in a data saturated society like ours, obviously, one of the ways that we express our values is through the data that we collect and the data that we do not collect. And so the data that does not exist really speaks to who we are and to how we represent our values. Um, so when we're talking about this algorithmic bias that potentially exists in AI and machine learning in healthcare, are there any safeguards in place currently in whether it's in the healthcare system or the legal systems that we have, or anything else that I might not be thinking about?
Yeah, there's actually brand new legislation that came out in May. It started the ball rolling in August of 2022, and it was just
Okay.
finalized this last May. So it took a while, as
Yeah.
regulation does.
Not
But and
amazed we passed
legislation,
anything.
yeah, exactly. So the new ruling, this new legislation, and this is just one bit. There's been a few other things that have come out, which is really great, at least in the US. I'm very US focused, so I tend
Sure.
to talk about the US a bit. The UK and Germany are also working on things, but um, part section 1557 of the Affordable Care Act which is basically safeguarding against discrimination in a healthcare setting. So these protected attributes like race, ethnicity, um, uh, national origin, sex, even pregnancy status. Those
Is
attributes, sorry, go ahead.
Sorry, I was just going to jump in for a quick second. Is gender
Yeah.
identity on that list?
Yes,
Okay.
and that is actually new to this ruling, which is great. Thank you for that. There's there's a bunch of things that got updated, which is awesome. One of them was about clinical algorithms.
Mm,
And so originally it was part of kind of civil rights protections in healthcare. And so the proposed ruling back in 2022 was to say, hey, we know these clinical algorithms or clinical AI is starting to be a thing.
yeah,
Um, they're not, 100% accurate. They could cause harm.
yeah,
We should have some sort of regulation or guardrails or
yeah.
safeguards in place. At the time, they called them, I believe, clinical algorithms or clinical AI
Okay.
algorithms, um, and wanted to get feedback, I guess, from different stakeholders at the time.
Yeah, absolutely.
And so the final rule, after getting a lot of feedback and comments and
Hmm.
everything, basically makes health entities, covered entities like health insurance plans and health providers,
Yeah.
hospitals and things, liable for any discrimination that happens when if they use these AI tools.
Hmm.
They don't call them clinical algorithms in this legislation anymore. I think they
Okay.
call them um, patient clinical decision support tools
Okay.
because that
Sure.
is more of an umbrella term, meaning it doesn't have to be machine learning or deep learning or
That
even
makes sense.
AI in general. It
Yeah.
even a flow chart
Yeah.
that you use, you're now liable if it's
Yeah.
found to be discriminatory.
Okay.
And
How are
so
we?
now, go
Oh,
ahead.
go.
Yeah.
No, please finish. I'm sorry. I'm so sorry.
Um, just just saying like the now these health entities could face fines if they're, found to be discriminatory, even if they aren't the ones who developed the software or the tool or whatever
Hmm.
they're using. So they have this responsibility now to do this ongoing sort of monitoring and check-in for these tools,
Yeah.
which I'm hoping will do two things. I'm hoping it will cause these entities to sort of pause and really um, do a deep dive before they adopt a new tool into their practice, whether that be like an AI machine
Yeah.
learning thing or something else. And then I also hope that it forces developers of these tools to be more cognizant of the harm and to try to mitigate and kind of audit their models before they even offer them to entities like this. So that's my hope with this new legislation.
Absolutely. Do we so being a mostly quantitative person, I immediately wonder, do we have ways of quantifying fairness, or is this vibes?
So it's interesting because it's kind of both. There's a whole spectrum.
Yeah.
And it's honestly what makes the field an area of research a little uh complex, I
Yeah.
guess. There's no one like this is exactly the definition of bias.
Yeah.
There's not one definition of that.
Yeah.
There are very
Yeah, for
technical
sure.
things, like if you're doing binary classification
Hmm.
prediction and the sensitivity or specificity are very different for groups, that's
Yeah.
technically bias, and depending on how harmful that is in practice, that could be discrimination. um
Uh,
yeah,
it
and
makes
then
sense that the level of the harm is part of it, as well as just the disconnect between the groups.
exactly, and that level of harm is where you kind of get to the vibes part, because who
Yeah.
determines how much harm is too much
Yeah.
harm and how much risk is too much risk?
Yeah.
And that is nobody knows.
Yeah, it's I mean, I use the word vibes as it's a little too offhand, I guess. It's just part of a human equation, right? I think one of the challenges here is that this conversation requires us to step out of the code a
Yep.
little bit, and sometimes some of us, that's not necessarily the most comfortable place. If you're like, I'm not pointing at myself sitting in the basement, tippy tap all the time, Um,
Yeah, I think that's what's interesting too for me because I'm very quantitative by nature.
yeah.
I think very quantitatively. And so when I stepped into this field or this kind of subfield, I thought it was a technical problem and I thought
Hmm.
I could solve it in modeling, maybe only, maybe
Yeah,
data cleaning. I wasn't sure. And
sure.
then all of these kind of new areas opened up and these new subjects. And now I'm working with people I never thought I'd be working
Yeah,
with, lawyers and ethicists and people who actually do that for a
yeah.
living. And so it's still difficult for me sometimes to really step out of that quantitative persona. But that's why I collaborate with a lot of people who know what they're talking about in those areas.
It's an amazing experience when you get deep enough into your technical stuff that you then suddenly find your way into the public experts, the ethicists, the lawyers, and it's like this is where the bath took me somehow. It's an experience I've had as well in different contexts. Um, this is really an amazing conversation. I hope we get to continue it sometime. Is there anything else that you would want to say about this topic before we kind of wrap it up? Is there anything I should have asked you?
Uh, since you probably have a lot of students or
Yeah.
people getting into quantitative things or even outside of quantitative fields,
Yeah.
because this kind of concentration or subfield or whatever, it literally takes people from every expertise area. It's not
Yeah.
just quantitative people, it's not just lawyers, it's everybody kind of collaborating together,
Yes.
trying to find incentives that overlap.
Yeah.
And taking people who care about the patients, obviously, but
Hmm.
these algorithms could also be proprietary and earn money,
Yeah.
for assets. And so this is going to take business people and it's going to
Hmm.
take legal people and medical people, but also quantitative math nerds
Yeah.
too. Um, and so it's going to take a lot of people. So even if you don't think you're necessarily in the AI field or the healthcare field, you could be roped
Yeah.
in fairly easily. Um, and I think the other thing I would also stress, because I stress it to my students as well all the time, and they don't understand it until they get into their full-time positions after their program, but communication skills are
Hmm.
very, very handy. And I think it's even more so for quantitative minded people
Yes.
because we understand the world, I think, in very, not a very different way, but in a different way than a lot of
Yeah.
people. And we can converse with each other fairly easily and understand things, if we like do it in like math notation.
Hmm.
We know what we're talking about, but other people have no idea. So learning how to kind of bridge that gap between
Yes.
quantitative and non-quantitative backgrounds is a very powerful skill. It takes a long time to hone that skill. I'm still learning how to do
Hmm.
it.
Same here.
Um, but you learn from different people and different
Yeah.
interactions and you get better over time. So I always stress the kind of soft skills, I guess,
Yeah.
if you would.
Yeah,
Um,
we need that, I really want to underline everything you just said. I'm so glad you brought all this up because I agree with it so wholeheartedly. We need to come up with a different term than soft skills.
yeah,
Because one of the things I frequently say is that sometimes the coding is the easy part. Not that
yep,
it's easy, but it's a defined task that you can figure out. I'm going to be able to implement this logistic regression or whatever it might be. And that's especially true now that we have tools like, GitHub Copilot and so on, that do a pretty good job writing the code. Um, and it's those soft skills that can be the hard part, actually convincing people and getting that legislation passed and implemented and identifying what fairness is and at what point in the process it really needs to be stressed first and foremost and where it is and where other things take precedence. And especially as technical people, sometimes we just assume the writing and the conversation and the collaboration just kind of takes care of itself. And I think sometimes that's a form of fear, honestly, because it's the part that we're less comfortable with.
yeah, absolutely. And I agree with you too. I don't like the term soft skills because it makes it seem like it's not important.
Yeah,
Soft is, I
yeah,
think, is a great descriptor.
yeah.
I
I
think
don't,
like kind of I guess I kind of put it together collectively as communication
yeah,
skills. I
that's
think it's
better.
more than that, or collaboration skills. I don't
Collaboration for sure.
know.
Um, well, if anybody watching has better ideas for terms than soft skills, throw it down there. Um, Dr. Mattie, thanks again so much for talking to me. If people want to find you on socials, where should they be looking?
So I am a little bit old school millennial, so I'm limited a
Love it.
bit. But on LinkedIn, if you search Heather Mattie
Okay.
Harvard, I'll usually pop up. There's not a lot of Heather Matties, so it works out. I'm also on Facebook and Instagram and X, but
Yeah.
I still tend to call Twitter. So
Sounds,
uh,
yeah, I think that's gonna stick around.
yeah, a little bit.
And I guess also wanted to ask you if I wanted to learn more about fairness or about algorithmic fairness or equity in AI and healthcare. Do you have any recommendations there?
Yeah, so I think a lot of good material is in kind of published academic papers, and a
Yeah.
lot of them are open source and freely accessible too. So you don't necessarily need to be like a affiliated with an institution or something.
Maybe you could share one or two with me and I can like link it or something.
Yeah, absolutely.
That'd be great.
So there's yeah, I'll share with you for sure. But there's a paper by Ziad Obermeyer
Okay.
that's amazing. If you look me up on Google Scholar, I have a few papers that also lead to other papers, which is great.
Yep. Love that
Yeah.
rabbit hole.
Yeah.
Highly recommended to find you on Google Scholar. Well, thank you so much for meeting with me and enjoy the rest of your day.
Yeah, thanks for having me.
Mhm. Bye, everybody.
Bye.